Let's talk about aortic stenosis. Coming to the causes and definition, like stenosis, as the word says, the outflow is reduced. The causes can be congenital due to the presence of bicuspid or unicuspid aortic valves, degenerative calcification, the second cause, which is mostly likely due to atherosclerosis, fibrocalcifications. Then comes the next cause, rheumatic heart disease, and the last one, mediastinal irradiations, given for some other pathologies like Hodgkin's lymphoma. These all can cause aortic stenosis. Coming to the clinical features, you see a triad of three symptoms which can be remembered with the help of mnemonic SAT, syncope. The patient experiences syncopes on exertion as the cardiac output is reduced. He also experiences angina due to subendocardial ischemia, and he also faces dyspnea because of the increased left ventricular and diastolic pressure. So these are the classical clinical features. Then remember, apart from this, we can see the other complications, like as we know that left ventricle and diastolic pressure is increased, it will increase the blood flow towards the left atrium, which will cause pulmonary edema. Later on, it can lead to even pulmonary artery hypertension, and this will produce the features of dyspnea, exercise intolerance. On examination, these patients are usually hypertensive. On pulse, you will find a anacrotic pulse, also known as pulsus parvus et tardis. Apex beat will be shifted towards left side due to cardiomegaly, and you will have a heaving in nature. On auscultation, you will hear crescendo, decrescendo murmur, carotid thrill will be also heard, and heart sounds will be narrow split, single S2, or it can be reverse split also. S4 sound will be also heard due to the left atrium hypertrophy. Coming to the workup, in ECG, you will find the left ventricular hypertrophy. X-ray can see you increase CT ratio. On transthoracic echocardiography, here comes the criteria of aortic stenosis. Like if it's less than area 1 centimeter per square, it's severe. If it's between 1.5 and 1, then it's moderate. And if it's between 1.5 and 2, then it's mild. And normally it's around 4. Coming to the treatment part, you will treat the underlying causes like hypertension, you will avoid sport activities, you will give statins to prevent atherosclerosis, and in the final stage, we can go for the transcatheter aortic valve replacement.